Dr. Steve, under which circumstances should a hypnotist refer their client to a licensed professional?
Well, great question, and we have to realize that sometimes hypnotists are called hypnotists in certain states because they're not allowed to be called hypnotherapists without having advanced training, advanced degrees. Sometimes they can call themselves a hypnotherapist. So sometimes we use those words interchangeably, hypnotist, hypnotherapist. We're talking about a professional using hypnosis in a clinical setting, and sometimes they get into situations in which they need to refer the client to a psychologist or a psychiatrist because really they're in over their heads. And a hypnotist or a hypnotherapist is usually trained within a very narrow framework. So they can do certain things, but a lot of things are way outside of their scope, such as long-term therapy, for example. So if a client wants to enter into a long-term therapeutic relationship with a hypnotist, that's not really appropriate because hypnosis is designed sort of like an oil change. You know, you go, or some sort of car repair that's going to be done in a short period of time. So sometimes we'll work with a client for a few weeks, but that's usually the maximum. We're not going to have them coming back to us week after week. That's the job of a licensed marriage and family therapist, or a regular therapist, or a psychologist or a psychiatrist, where you go in for talk therapy, and sometimes that can go on a long time. I'm not a huge fan of that, but sometimes it can go on for 10 years. That's considered normal. In hypnosis, that's not considered normal. What's normal in hypnosis is just a few weeks of working with them. So if you've reached the end of the few weeks and they're not getting the change that they want, that's a good time to refer them. If you feel that they have some sort of mental illness, that's a good time to refer them. As a hypnotist, hypnotherapist, you're not licensed to diagnose. And so diagnosing someone can get you into a lot of legal challenges. If you write in their notes they're psychotic, for example, or they have schizophrenia, that's a diagnosis. You do not diagnose as a hypnotherapist. You may have some ideas that this person is acting in a way that I don't know how to deal with them, and I suspect they may have a mental illness. That's fine. But to diagnose is not your place. So what you need to do in those cases is simply refer them out. You don't tell them that they have a problem. You just tell them that you feel that you are not equipped to work with them and you are going to refer them out. And the idea of referring out is very important because there has to be some place to go. Usually a person who goes to a hypnotist, that's their last resource. That's their last thing they'll do. I mean, sometimes it's right before leeching. They think of it as something very extreme that they're doing. My goodness, I'm going to a hypnotherapist. It's my last chance effort. If you tell them there's no place to go after their last resource, that could be a real challenge for them. They could really go into despair. Unfortunate things could happen in their thinking and in their actions. And we don't want that. We want there to be a place to go. And the place to go is to someone who knows more than you do about what they're dealing with, or knows exactly what it is, because you may not even know what it is you're dealing with. So that's why it's important to refer them out. So those are some of the circumstances under which you would refer out.
Wonderful. Thanks for sharing this information.
Oh, my pleasure. For more information about hypnosis, just check out the resources I have at stevegjones.com. And there's even a free hypnosis recording for you there. I'm Dr. Steve G. Jones, clinical hypnotherapist, hoping you have an outstanding day.